you. Thank you.
And while we are at talking about the physical manifestation and the physical well-being, I would like to take this opportunity to introduce our next speaker, who is going to talk to us along those lines. So we have Dr. Bharati. She is a physiotherapist with more than 15 years of experience in wellness, and she is also an expert in manipulation, acupuncture, and varmam, and she is here to talk to us today about pain management. And I think that's a very pertinent topic in today's world. So, without further ado, I would like to invite Dr. Bharati to come and address all of us. Dr. Bharati, please.
Yeah, thank you. Good afternoon, ma'am, Shantipriya ma'am, and sir, like all the participants who are here in Acharya 2022. I'm very grateful, ma'am, for giving me this such wonderful opportunity. And this is my first time speech I'm taking over in live session. I think it would be great and interesting. I'm very happy, ma'am. Okay, now I think all would have experienced about pain management, pain, right? My topic is pain management. How do we manage pain? But before that, we should know what is pain. Pain என்ன என்னன்னு தெரியணும் இல்லையா? I think everybody would have undergone pain. எந்த நமக்கு கஷ்டமா தானே இருக்கும் இல்லையா? Going to pain management, we will first look at some points of what is pain. Pain என்ன? Pain is nothing but it is a physical body's response to a stimulus. And the stimulus எதுவா வேணா இருக்கலாம். It could be burn, or it could be hot surface, or it could be a pinprick. எதுவா வேணா இருக்கலாம் இல்லையா? So to meet the pain management, we should concept of what is it. நிறைய types of pain இருக்கு. நம்ம எல்லாருமே நிறைய types of pain feel பண்றோம். See, a person sitting in with computers has so much of neck pain. A person riding a bike, he has so much of shoulder pain. And now diabetics, they are with this frozen shoulder where they even can't lift it. So pain வந்து ஒரு பர்சனுக்கும் மாறும், and it is very different. இதுல பாத்தீங்கன்னா there are 4 types of pain. We'll first is the acute pain. ஒரு அடி பட்டுச்சு உடனே அங்க வீங்கிரும். Yeah, we have this inflammation, this redness, swelling, everything going around. That is an acute injury. இதே வந்து if it is going to be a chronic one, it will stay for a longer time. It takes time for healing. Healing க்கு அது time எடுத்துக்கும். We call that as chronic pain. And we have this neuropathic pain. எதனாலனாக்கா people will say that I have this neuropathic pain which is going through my leg, and that is because of the pulling of the nerves which is coming from the spinal cord and due to their overload in the vertebral column. அதனால கூட they will have this pain. So we have to carefully notice the pain. That is, the characteristics is more important in the pain examination. See, the pain actually on major characteristics. That is the location, where it is located, and the intensity, how intense it is, like how much we are going through it. And what is the aggravating factor? Whether I have this pain in sitting, or I have this pain in standing, or when I walk I get this pain, or when I lie down I get this pain. And what is the relieving factor? Now in the position that I'm not getting it. So according to that, as a physiotherapist, it will be easy for us to calculate the intensity and the locality. With that, we'll come to a conclusion to therapy, full therapy of treatment to be done for that particular pain. So the characteristics is more important in judging about the pain. And how this pain is carried by the body. We have to think about that. எப்படி வந்து pain a person is able to perceive. See, it is all about the pathways that is taking the pain to the brain. See, first, when a person is hit or cut on the skin, there are some receptors that is present in the skin, which takes the signal to the spinal cord level. From the spinal cord, it goes to the thalamus, and from the thalamus, it is perceived by the brain. Yeah, there is something that is hurting me, so I have to do something to get rid of it. இப்போ நம்ம பார்த்தோம்னாக்கா லைக் சூடா தண்ணி பட்டுச்சுன்னா we involuntarily take our hand. So that is involuntary protective mechanism that is done immediately. In a fraction of second, the brain does it. You know, there is something that is coming to hit me, so I have to move it. Whatever I'm telling you, it all happens in a fraction of second, and this is happening. This is the pathway that is happening in the brain to get the pain to be perceived. Okay, now coming to the இப்போ நம்ம எப்படி தெரிஞ்சுக்கிறது? How do we come to know that this person is having this much of pain and in this aspect and in this quality? So for that, there is a scale. We call it as visual analog scale. I'll just show you. See, there is a chart like this. There is a chart like this. We actually, actually I have a clinic at Kolattur, and where the patients come and I need to take this chart for each and every person, and I used to ask them, where is your pain and what is the level of intensity and where do you stand? See, the scale, if it says 0, there is no pain at all. And if it is going to be 10, it is going to be tremendous pain where the patient cries because of pain. And if it is going to be 5, then it is here and there between. The pain has started and it is little aggravated. And if it is 2 or 1, or it is like that. So it's according to that scale of pain, we tend to know, okay, this much of intensity or the person, and this is what we have to be giving the therapy. So this scale has plays a major role in identifying the intensity, the character, the mode of onset, and the quality of the pain. This has made a very easy analysis for a therapist to judge a person having that severity of the pain. Okay, now this is the actual topic. This is management of pain. This is my topic. In this, I am going to tell about 2 aspects. That is pharmacological method of treating the pain and non-pharmacological method of treating the pain. Okay, now usually when we suffer from pain, we usually take medicines, right? Pharmacological method. We go with analgesics. We go with aspirin, which is given for mild to moderate pain. And we go with what is it? Non-steroidal anti-inflammatory drugs. If the pain is very severe and we are suffering with that, then doctors prescribe these medicines like ibuprofen and this aspirin, everything to reduce the pain. And we also go for opioids. Like we have this cancer patients where they suffer with very much pain, and the pain is to such an extent they cry off. So for that patient or that person, we give this kind of medicines like oxycodone and morphine and anything, and all these types of medicine to get rid of the pain. And as such, like when we suffer because of pain, we try to use this local applications like gel or oil or maybe this ointment and this local applications to treat the pain externally. That actually works wonders to a certain extent. So we all use this, and certain medicines which is called as antidepressants and anti-epileptic drugs we give if there is a nerve pain. So all these are decided by the doctor with the complaints when the patient goes in, and he decides of what treatment to be given according to the condition of a person. Now, coming to the non-pharmacological method of how we can treat the pain. First comes the physiotherapy, my role. I am very proud to say that physiotherapy plays a major role in treating the pain. And to start with, in physiotherapy, we have certain modalities that is used to control the pain. That is like TENS, which is called as transcutaneous electrical nerve stimulation. So this stimulation actually helps to relieve pain. But how? Like we have this small electrodes that is kept on the body surface. So this actually a micro current goes in through the patient's body, a person's body, and through this the pain receives, the brain receives a signal that there is a pain coming around, and now I need to take care of that, so that the actual pain of us is actually not felt. So this is called as counter irritant method. Like how we use this pain bombs by applying for headache. Because of that, the irritation of the pain bomb goes first, and the actual pain is actually suppressed. It is not that it is gone, but it is suppressed. So this is called as counter irritant method. So this is the method we use in physiotherapy by using this TENS machine. So this has played a wonderful role in treating persons with pain, even with neck pain or back pain, whatever it is. And massage. The next comes the massage. Massage plays a major role in by just giving a kneading, soft tissue kneading movement. This helps by improving or washing out the pain substances, thereby increasing the blood flow and the pain, and the person gets immediate relief. He gets immediate relief of pain, and I have seen it in my clinic. So this kneading also, this massage also helps in reducing the pain. Then comes the joint mobilization or manipulation. Manipulation is nothing but just by simply using the hands-on therapy on the particular joint. Say for a person is having a shoulder pain and he is suffering for a long time and not able to move his hand to an extent. So that time we use this manipulation just by doing some movements on the joints. The range is improved and the blood flow is improved, and thereby the pain is reduced. The basic idea is to improve the blood flow, to reduce the inflammation, and thereby improve the movement and improving the quality of life of that patient or the person. This is it about the manipulation. There are certain things like stretching that is used to improve the muscle pain and the joint stretchability, which also plays a role in improving the quality or improving the range of the person. There are so many stretches according to the condition. But now I think I can show you some neck stretches, because person who are working with computers, they will have this neck pain, very common symptom, and people complain to my clinic also regarding this as neck pain. Ma'am, I have so much of neck pain and I can't even sit for a long time. So in that case, you can follow these simple tips, by just following you can be sitting at the same place and just doing this simple steps. See, whenever you are in the monitor, your monitor level should be your eye contact level. That is the main point. For a working professional, they'll be in the computers working for hours. They don't even know that they are working for this much hours, because they will be in rush of the work to be done, right? So the placement of the laptop should be in such a way, or the computer should be in such a way that it should be near, direct to the eye contact, eye level. And they can do some simple stretches, like they can do the neck stretch, turning from side to side. Just doing this, seeing up and going down. Doing these 4 steps just by turning side to side, turning up and down, gives a very good relief in your neck area that helps in your neck pain. And you can just, in the sitting place itself, you can just rotate your arms like this, clockwise and anti-clockwise, which is really helpful for the neck area. That is, this muscle which is connected to the neck, that also gives relief of the pain, neck pain. You can get relief of the neck pain. And the moreover, when sitting also, you can just follow right angle posture. That is, your back and your leg, it should be 90 degree. When that is there, your back is not hurt, and moreover, your neck is not hurt. So you have to follow that. And if you have a hand support on the side, it is very well and good. So these simple steps to follow while at the workspace will definitely be helpful. And you can go for a walk every 30 minutes. You can go for 2 simple walks. Just you can walk there and come, and that is very good for your lower limb blood flow or circulation, which will improve or which will not make. You can get more blood flow to your lower limbs, and that way you will not get that much of back pain. These steps, I think, we can follow in our daily routine or in our office goers. It will be helpful so that they will not have much pain. And next, coming to the therapies, see, these are the steps, or these are the treatment which we give as like physiotherapy and then hot water bath. hot water bath plays a major role in giving very good relief because it improves the blood flow. See, a person having a back pain, immediate relief at home, what we can do? We can just do some hot water packs and see whether it is improving the blood flow and thereby reducing the pain. So if at time in the middle of the night we are suffering with back pain and we just want that to get rid of, so we can just start with the hot water baths, and that will definitely improve your pain level. So that you can give. And sometimes when you are hit and your part is like you have the swollen leg or swollen hand, and immediately you want to get treated with that, you can give ice packs. So ice packs are the best, and the hot packs are really a very good mode of treatment for relieving the pain with immediate effects. So these we follow in our clinics, and also we can use this at our homes to get relief of pain. And with this, we can also add up the alternative therapies. Like we have so much of alternative therapies like acupuncture, yoga, and Varma relaxation techniques. All these in combination with the other therapies definitely will improve one's pain. And this acupuncture, it is a traditional Chinese medicine which is followed nowadays by many people, and that is giving a great result without any side effects. And maybe I will be happy to share you some points like for headache. If any person is having headache, you can just apply pressure over here. That is, see, this is the base of the thumb and this is the base of the index finger. In between, there is a point. Okay, you can just give a massage for a minute. Just giving a massage for a minute, you can see your headache getting relieved. That really works wonders. And when you flex or when you bend the elbow, there is a crease here, right? Can you see? There is a crease here. Yeah. If you can touch that and you can give a point, it improves your immunity. See, these are very simple steps and we can follow it, I think, and we will be getting benefited out of it. And people having high BP, if you want to get control, see there is a point here. This is the middle finger, right? This is the middle finger. Can you all be able to see it? This is the middle finger. The nail bed. Can you see the nail bed? Above that, you have a point. So you can just give a pressure deeply for a minute, and you can see your BP gets controlled. And this has to be done progressively day by day, and you can see that both the hands you can do, and you can see that the BP gets controlled day by day. So not only for this, we have so many acupressure points in our body to get relief of different kinds of pain. So this plays a major role, and acupuncture is a very good very good treatment for any kind of pain. In fact, for any bodily conditions also we can use it for thyroid and for any problem, nausea, vomiting, fever. For each and every condition, we have certain points to be stimulated, and you get relief of that. And we have this Varma. Varma is our own Indian traditional medicine, which is recently they have been using, but it is an ancient form of medicine. But now it is becoming aware because now people want to get rid of pain without taking any medicine. So that's how it is getting very popular nowadays. And Varma also we have this headache relieving point. See, all you can see the eyebrows, right? Just the corner of the eyebrow 1 inch below. Here is the point. We call this point as Nakshatra Varma. Okay? You can just stimulate this point for a minute. You can close your eyes or you don't want to, also it's fine. Just try to give a pressure on this spot. Deep pressure. Yes. And you can feel that your headache is getting slower and slower. This is one Varma point, but we have so many Varma points to be treated for many conditions. So it will be very useful, and it has no side effect at all. So if you use it, you will be very relaxed, and that is going to help you in your pain. Then why not we just try that? So this is a form of treatment, that is Burma and acupuncture. There are other therapies, as Ms. Vyamdashi ma'am said about yoga. Yoga plays a major role in improving the joint mobility and the flexibility, because it has its own postures to be followed with in a relaxed manner and in a breathing pattern. You will feel a great difference of your range increase, and I have felt that. And also many people in my clinic, I have suggested yoga, and they have given me suggestions, ma'am, this is really working wonders. So yoga is a very good form of treatment. It won't be a kind of like treating, it is like a form of exercise which is helpful to the whole body, not only a particular joint or particular type. We can do it for the whole body, and your body get very relaxed, and whatever pain is there, it will go on its own when you do this progressively. And there are many other alternative therapies with this, like yoga, and some relaxation techniques are there, where we can relaxation technique where we can set up our mind, because pain is something related, not something, it is very much related to our brain concept, because we have this pain because of the previous experiences, or fear or anxiety or stress, that is causing the muscles to become tensed, and that is the spot we feel the pain. So if we follow this relaxation technique of just staying in a place and closing your eyes and saying just, I am good, my body is reacting, I am healing, and the part that is injured is healing. Just saying this at a place, in a calm place, and you're going to do this in a relaxed manner, definitely it is going to help you. And you have to do it daily uh, with a point of when doing it in a relaxed manner. This also will definitely help you. These are the other alternative therapies which are useful to make the pain, or to reduce the pain intensities. And there are much to say about it. Now I'll just end up with saying some tips about neck and the back pain. What are the tips we can take it for the neck pain to get, if you have the neck pain, what you can do is, you don't use a high pillow. Please avoid using high pillow, so that your neck is not too much flexed and you will not feel that pain. So don't use high pillows. And the next is, don't turn suddenly. Like when we don't tend to turn suddenly, but at times we might not feel like it is safe, like we try to do this and we get into trouble. So don't side turn immediately, and don't use high pillows. And you can use this regular exercises to get relief of the neck pain. And for the back, if you're carrying any weight, lift the weight on both the hands with equal weight. See, if you're lifting some bucket full of water in one hand, you can also do the same on the other. Or you can just distribute that single weight into both of it, and you can have it, so that you will not end up with neck and back pain. That really has an impact on the neck and back, which people are not aware of. So try to take up the weight which is equally distributed. And if you're going to take up anything, any object from down, see, for example, a pen is fallen and you want to take it, you don't go bend directly with your back and take it. What you can do is, you can bend your knees, just try to sit and take the pen, and then you can stand. In that way, these tips will help in um, not injuring your back or the neck, and you can follow this in your daily routine to become more flexible and pain free. And I think, like, I have told much about pain management, how to do pharmacologically, as well as what are the alternative therapies, and with physiotherapy, what are the treatment modalities or the management we can do. And I'm really thankful, Shantipriya ma'am, for giving me this wonderful opportunity. I'll end my session here. Thank you, sir, also for giving me this. Thank you, ma'am.
Yeah, that was really great, Bharati. You have
Thank
wonderful acumen in your field, and whatever tips you had given, no, especially because there's no body without pain in today's life.
you.
Sedentary lifestyle, I can call it as, like everybody has one pain or the other. either neck pain or back pain or stomach ache or leg pain, knee pain, whatever it is, just name it, they have it. And now the tips and various therapies, alternative therapies, which are available apart from the normal medicine, medical science, that really is going to be useful for each and every individual who has attended this session.
Absolutely.
And the way, the energy you carried right from the beginning till the end was really amazing. The
Thank you.
same energy you were able to carry. I think you got it. That energy level was awesome. It was wonderful. I believe and hope all the students and all the viewers who are watching this in YouTube as well, Zoom also, would be greatly benefited with your wonderful session and also apply it in day-to-day lives. Thank you so much
Thank
for
you, ma'am.
having come to this Acharya 2022 and honoring us. That was a great session.
It's a pleasure,
I
ma'am.
pass it over to Vaideshwaran.
Thank you, Dr. Bharati. You were saying that this is your first time coming on a Zoom session. It didn't look like that. You were sounding brilliant, and I think the tips you gave were also fantastic.
Thank
And
you.
as a person personally who sits in front of the computer from
Come.
morning to evening, this is very, very helpful for me. And I'm sure that I'll be practicing, um, if not all, at least most of the tips that you have shared. So thanks a
Definitely.
lot for
I'll be grateful, sir, helping you. You can contact me for any queries related to exercise or anything. I'll definitely help you.
absolutely. Thank you.
Thank
Thanks a lot for honoring us by being here.
thank you.
Our best wishes. Thank you.